Marcy Zwelling, Aamot, and Dr. Marcy, you're the president of?
I'm actually the chairman of the board of the American Academy of Private Physicians, a group of doctors in the United States that works directly with their patients to give them the very best health care we think that they need, as opposed to what their insurance company or the government will buy for them.
Yeah, so I understand that a lot of, or the easy way that people know you as a doctor is concierge doctors, yeah?
Yes. We're most commonly called concierge doctors or boutique doctors, but truly we do more than reservations. Mostly we are the premier patient advocate. And we believe very, very strongly that it is the patient-doctor relationship that drives everything good about healthcare. The financing should follow what the patient needs, and the patient should make those decisions using the information that they get from their most trusted person in healthcare, and that would be their private physician. That physician then can coordinate their care with specialists and institutions across the country or around the world, quite frankly, to find them the very best value and very best quality for their problem, or perhaps even to invest in their future. So for instance, stem cells. How do you secure stem cells? You want to save your stem cells so that in the future you might, God forbid, need them. Are there opportunities worldwide? We provide that for our patients, all of that information and access to just about anything health that they might need.
So you're located in California, but you actually have patients from all over the country and all over the world coming to you.
Exactly. One of the things that I believe is that in the current system, as it is in the United States, patients often go to doctors because that's how doctors get paid. So if the doctor's going to get paid at all, the patient has to show up in their office, wait 4 hours in a waiting room, and then, of course, get 5 minutes of their time. Not a very effective or efficient way to really deliver health care. So why not set up a system that everything's about the patient? And why not allow them to text you or email you or whatever? Quite frankly, we Skype. So now patients from all over the world can come to my office, and similarly, they can access from my office other doctors anywhere in the world, and you create a global opportunity for patients. So they can be anywhere, even if patients are traveling. For instance, they may live next door, but they travel. So they call me from Brazil, or they call me from Germany, they have a problem or they have a question. They can access that. It doesn't cost anything to Skype or to text, and I text them right back. So I'm available for them, and they're not sitting in waiting rooms or driving in their cars for 4 hours to get to the doctor. It's very much more effective, we think. And it really is centered around what does my patient need, when do they need it, as opposed to what's paid for by a system that really doesn't have my patient's interest at heart.
Right. So we're here in Turkey.
Yes, we are.
In Istanbul, at the Acıbadem Hospital Group. And it's interesting because you and I have traveled around the world now, looking at different healthcare systems. And I guess the question that I have for you as an American doctor is, are there global opportunities or global options for patients in the United States when they start to look abroad and say, I need surgery?
There are tremendous opportunities. And my first visit here, I think I spent the time with my mouth open, just gaping open, because I think that we don't have that impression of Turkey necessarily. The United States has been a leader in healthcare, and everyone thinks it's the United States driving the system. I think that is changing. I think that the world is not only catching up, but I think in some places they have caught up and they're moving ahead. So we have a number of obstructions to care, including government and insurance, and we have not exercised patient choice as a central theme. But in fact, that really is how the best health care is found. And here, and particularly in Acıbadem, I was thrilled to see systems, processes that work, and that really are very sensitive to the patient per se. It is a service opportunity here that we don't do as well in the United States, quite frankly. And there are processes here that are smooth, deliberate, and I was so impressed with everything from the fact that people know what the cost of care is here, and that's very important for patients. But indeed, even the processes, how their surgery teams worked. And I was in the OR, I scrubbed in the OR, that was a lot of fun. And I saw a transplant, I saw a renal transplant done laparoscopically, as we would do in the United States, and I saw a tremendous team effort. So when you deal with healthcare, you deal with processes and people, and I was thrilled to see that Turkey, and specifically Acıbadem, really is at least as good as the United States, and perhaps in some cases better, insofar as they actually have a value-based system where the costs are known ahead of time. And so there is a security and a surety when you enter these systems. So I came here direct from Los Angeles on Turkish Air. Boom, boom. What a wonderful flight. And they are now, I believe, they go from multiple cities in the United States. So a patient could certainly drive 2 hours to go to a hospital to sit in a waiting room, or they can get on Turkish Air and fly direct from Los Angeles, land at the Ataturk airport, get picked up, and the next thing they know, they're in a really nice hospital bed where the food is good and the families are cared for, and it's a system that works. And I think that once Americans start to learn about it, there will be a waiting list for patients to come over here, because it really is an opportunity.
Yeah, it's interesting because I think that you're one of the few doctors that I know that at least the American doctors that I know, that I've spoken with, who is very proactive in looking at global options. Again, you don't see it as a threat, you see it as an opportunity.
Right. But I think that is actually because my organization and what I do is I work for my patients. So in the American Academy of Private Physicians, we really are all about the patient. I see insurance as a payment system, but they can also become an obstruction to care if we're not careful. And we end up then doing what's paid for instead of what's needed. So my opportunity, quite frankly, to do a better job for my patient, which is what I'm supposed to be doing. I work for them. So I compete for my patient's care. And there probably is someone who thinks they can do it better, and that's actually good because it drives me to be even better than that. So I find opportunities for my patients because that really is my job, whether the opportunity is down the street or it's across the continent or across an ocean. If I have effectively done that, my patients will have the best opportunity for that better day. They'll have effective care, they'll have quality care, they'll have less expensive care, they'll be satisfied, they'll be back to work sooner, and that's really what I do.
So when you go to a hospital like this, and there are many, many doctors, highly qualified doctors, how do you pick? How do you judge or evaluate doctors as potential referral doctors that you would send patients to?
First of all, I use a lot of the same techniques as I use in the United States, and you know there's a human thing there where you can kind of get what that person is all about. So among the things that I really saw here were a number of physicians that really worked very well together and integrated systems to work for the patient. So I looked for that. Clearly, I looked for training, and I was not surprised, but really very pleased to see that doctors here were incredibly well trained, many of them in Europe and even in the United States. In fact, neurosurgery, these are not just well-trained doctors, but the father of skull-based surgery is right here in Turkey. I mean, what an opportunity, right? And they were very engaging. They spoke English, which was also very important. So you could see that there was, they wanted to work with us. So, you know, that's always quite frankly, sometimes you call a doctor's office and, you know, you meet with that wall and they're really not interested in engaging the patient. I didn't see that here. They didn't look at their jobs as work. They really looked at it as a pleasure and a privilege, which is what it is, I think. So I look for that in a doctor. And indeed, as I get to know the doctors better here, I'll be able to find those doctors that are best suited. But from cardiovascular surgery to neurosurgery to orthopedic surgery, infertility, I saw opportunities in patient care that was incredible. And I interviewed patients, and they were pretty darn happy. And I will refine, just like every doctor does, you refine those relationships, they will grow. But I can tell you, when I came back from Turkey, I wrote to these doctors. They wrote back to me.
Yeah,
and that, I thought that was really important. And so, you know, they wanted to engage.
You know, it's funny because I think a lot of medical tourists, American medical tourists, end up relying very heavily on non-medical or non-hospital people to identify where they're going to go for healthcare. And, you know, sometimes it works and sometimes it doesn't. And I think that one of the missing links, if you will, in all of this has been the engagement of a physician like yourself in the United States to say, I can help you.
And that's not an isolated thing. So I engage the patient and their physician, Because again, I don't want to in any way dissolve that relationship, just strengthen that relationship. Work with their doctor, find the doctor here in Turkey, create an electronic opportunity so that records are exchanged and conversations happen before the patient comes here. So the expectations are legitimate and real. The continuity is there, and it all centers again around a patient-doctor relationship. So when that doctor is engaged with the patient, we'll see the opportunity really be much more successful. So I will help their doctors find opportunities here, and obviously keep in touch with them and make sure that all those things, continue to happen the right way. So this is not about disillusion of those relationships. We hopefully will strengthen those relationships, because you're right. Today, patients randomly choose a place, and God forbid something should happen, and they don't even engage their own physician because they think, my doctor will be angry. Well, no. If that is the right doctor for you, he or she wants what's best for you, they will engage the process, and they will be more than happy to marry your care with a place where you can get it done most effectively and very efficiently. And if that is Turkey, I think that's an opportunity that every American should be able to have for themselves.
I think the AAPP is an interesting body in the sense that the physicians who are members are independent physicians. You're not tied to an insurance company. You're not tied to a specific care organization. You independently can suggest to your patients, I recommend this, and if that's a local solution or a global solution, you're not, again, beholden to any one individual or any organization to define what is the best thing for your patient.
Precisely. In the United States, there are a lot of things happening now that are not so good, in my opinion. If a doctor does not work for their patient, there is an inherent conflict of interest. I'm not blaming anyone, because it's just human instinct. It is just naturally human that if the doctor works for the hospital, he needs to make sure that things go right by that hospital. And quite frankly, or he doesn't have a job. But there are conflicts, and the conflicts are created by all the financing institutions that are now involved in the patient's care. And so what happens is that decision-making really gets very fragmented. And again, it gets been driven by the wrong things. If there is anybody that should not be conflicted, it should be the doctor. The doctor needs to represent the patient only. And then you can find the right care that is most effective and most efficient. You may have to use systems that are covered by their insurance. But when and that's fine too. I'm not suggesting that insurance is not important, because of course it is. But indeed, I will direct the insurance company to what they need to pay for. They're a payer, not a caregiver. And the patient then gets the care that's needed. We waste a lot of money in the United States with doing what's paid for. And so, it's kind of like, well, I'll do it this way first, and if it doesn't work, well, no, let's do it the right way first. Let the care be directed. Let's not jump through hoops just to jump through hoops. So the conflicts just create more hoops, and it becomes more expensive. I think the decision-making is not as good and potentially bad. So why would you want to even engage in that opportunity? Being a private doctor, the doctors involved in private medicine really are not conflicted. And I think that is a very important distinction to make for all patients in the United States, and quite frankly around the world. I can't tell you what's going to happen to healthcare in the United States, but if I have anything to say about it, we will strengthen the patient-doctor relationship. And whatever payer models we use, they will work around that relationship, because that core drives everything good in healthcare. And studies are starting to show that we meaning those doctors that do what I do, spend more time with our patients. And in that delivery, our patients don't go to emergency rooms as often, they don't use specialists except when appropriate, and their length of stay in hospitals are less. So by definition, the care is better because their care is not redundant.
Sure.
Right? So it makes sense.